Hi guys, welcome back to Heart to Heart. This is Dr. Raj Sugumaran, board certified interventional cardiologist and lipidologist here in Phoenix, Arizona. Here to break down complex cardiology topics so that you guys can understand it better. We've had a lot of great responses on the last episode on LDL lowering, the power of LDL lowering. And somebody had asked, what's a calcium score? And do I need to get a calcium score? And then how do I interpret a calcium score? So a calcium score is a scan that basically tells us if you're starting to develop coronary artery calcifications or calcium deposition within the linings of the arteries of the heart. So it's really beneficial for patients who are asymptomatic, no symptoms, and they're at least intermediate cardiovascular risk. And we base that risk based on an ASCVD, atherosclerotic cardiovascular disease risk assessment tool. There's an app for this. And really, if one is deciding whether or not to start a statin or any other lipid-lowering therapy, or if they would benefit from lipid-lowering therapy, let's say your LDL is between 100 and 130, and you're in that gray zone, no risk factors, I would get a calcium score. And if anything is more than 0, you would benefit from lipid-lowering therapy. The disease process has started. If your calcium score is more than 100, you definitely need lipid-lowering therapy. And if your calcium score is more than 400, that is high risk for future events. That means the disease has started. Calcium or hardening of the arteries have started. So calcium scores, you would get that once in your life. You would never track a calcium score, but guess what? Why? Because as we get older, our calcium score is naturally gonna get higher. And also, don't be fooled by a calcium score of 0. You could have soft plaque and still have a calcium score of 0. So hopefully this helps. Get to know more information about your body to make the best decision. Thanks, guys.